we're live.
I think we are live now.
We are live.
Thank you, Harry Underwood. Thank you, Harry Underwood, for our Facebook friends and public. We were having some technical difficulties, and it was operator right here. And so I think we are still, it says these comments will not be broadcast. You and anyone broadcasting with you are the only ones who can see them. What does that mean, Harry?
Yeah, that's what it says.
Like, I have no idea right now and everything, but you're live right now. You're recording the video.
Okay, why don't you go on and make sure that we're live? Okay. All right, it says we're live. So anyway, I guess we can get started on this here. Well, this is, we come on every week, Pop Warren's Health and Community Tips for the week, because we will be coming on 52 weeks out of this year. And the purpose of our program is that the Bible says my people perish for lack of knowledge. And so I'm on here to make sure, along with two community partners, and that's Tree of Life Healthcare and New Horizons Behavioral Health. And so normally I introduce Ms. Andrea Wilson, who is the Chief Executive Officer of New Horizons, and Susan Gallagher, who is the Public Relations Person, and Reverend Laurel Client. But at the moment, I think Reverend Laurel Client is off the air right now. And so I have Miss Gloria Mott. Gloria, will you introduce yourself to our viewing audience?
Yes, good morning. My name is Gloria Mott, and I am the Nursing Director with New Horizons Behavior Health, and also serve as the Outpatient Service Coordinator.
All righty. And you have a very excellent program. And tell us a little bit about yourself, first of all. How long you been with New Horizons?
Well, New Horizons practically raised me in my nursing career. I have been here for 30 years.
Oh, Gloria and I used to work together, by the way,
Yes.
when I was the outpatient nursing supervisor at New Horizons Outpatient Clinic, and Gloria and I interfaced a lot. I don't see Reverend Client, and I don't know whether he's on. Reverend Client, are you on with us? I think we lost him, but I want to talk a little bit about these two organizations. I have partnered with these two organizations, New Horizons Behavioral Health and Tree of Life Healthcare, because Tree of Life provides the physical health, anyone with any physical ailments, and New Horizons they take care of individuals who have behavior problems. These two organizations provide services and over the years to our community for individuals who don't have any finances, don't have any money. And that caught my attention. And so I partnered with them to help take care of the needs of the community. Part of which I feel is the first triad in nursing is communication. Because if we let individuals know what they're supposed to do to stay healthy, they'll be healthy, both behaviorally and physically. And so that's why I decided to have this program and to partner with these two fantastic organizations. And so today, our guest presenter is Gloria, and Gloria is going to present on a very good topic. It's COPD. And Gloria, I'm going to let you start, and you're in the driver's seat. So I'll just let you begin.
All right. Yes, this morning we're going to be talking about COPD, and I'm going to share my screen. You see the slides pop?
And they have to go to the.
You know what? I don't think I did.
We're hearing all kinds of music in the background. Sounds good, but I'm not ready to dance yet.
No. Okay, you're gonna go here, application window. Where's your COPD slides?
And for all of our Facebook
There you go.
audiences,
You want to go here from the
a
beginning.
lot of times we have a little technical difficulties, but we will be getting down to the nitty gritty.
Make sure you can see it. Pops, can you see that?
I can't see the slides, no.
Okay, I'm gonna go back out here. So we need to go here.
Hold on 1 minute.
So if y'all just be a little patient while we get through these technical difficulties, we will get our information to you. And we've got Susan working very diligently to get our slides up to you. If not, there we go. That's it. So let's start. Why don't we just start with that one? Start with the slide that meaning of, there you go, Gloria. You got it.
All right. So we're going to be talking
What is the
about
meaning of COPD?
COPD stands for chronic obstructive pulmonary disease. which is a term that talks about it's a chronic lung disease, and it can include emphysema and chronic bronchitis, and it's characterized by breathlessness, okay? And COPD is currently an incurable disease, but with the right diagnosis and treatment, there's many things that you can do that can help you breathe better and live a more healthier life for many years to come.
And just to make a comment on this one, this is very important. This statement here that you have in the paragraph here, it says, this is an incurable disease.
Correct.
I want everybody to hear this here. But with the right diagnosis and treatment, there are many things that you can do to breathe better and to slow the progression of this disease. And so it's very important to have early diagnosis.
Right.
Next slide, please.
Okay. Just quick overview. Chronic means that the disease has been there for a long time and is always present. Obstructive means that it's blocking the movement of the air in and out of the lungs. And pulmonary means that it's a disease that's located in the lungs. And disease means that the lungs has been damaged.
Right. Next slide.
All right. Types of COPD: emphysema and chronic bronchitis. Emphysema, there's damage to the air sac, which is called alveoli, and that causes emphysema, okay? And the walls inside the alveoli, they disappear, the sacs become small, and then it just causes those sacs to collapse, and the oxygen has trouble moving back and forth from the lungs into the bloodstream, okay? And then with chronic bronchitis, there's damage to the bronchioles, which causes chronic bronchitis. Those bronchial tubes become irritated and swollen. You get the coughing, you get the shortness of breath, mucus builds up, and then, you in turns have chronic bronchitis.
Right.
So you see there where we talk about emphysema, chronic bronchitis equals COPD. Okay.
Next slide, please.
All right, just a few statistics about COPD. COPD is the third leading cause of death in the United States, beaten only by cancer. That's the second leading cause, and then heart disease being, the leading cause, okay? Over 24 million people suffer from COPD in America. Many people with breathing problems don't realize that it's the result of COPD, okay? Female smokers are 13 times more likely to die of COPD than women who have never smoked before. Okay. And then Alabama, which is, right next door to us in Kentucky, but wanted to point out Alabama and Kentucky have COPD prevalence rates that are over 9%. And it is estimated that 90% of people with COPD are current or former smokers.
Which is something to highlight, because everyone knows the damage that cigarette smoking does to the lungs. And one of the things that we want to highlight towards the end of this is that there's hope for individuals who are smokers.
That's correct.
Next slide, please.
All right, this just shows you a picture here about the lungs. You can see the lungs here. You see what a normal airway looks like, and then you see one that's filled with mucus, how it's narrowed there. And then you see a picture of the normal air sac, and then one that has been broken down as a result of COPD or chronic bronchitis. Some of the symptoms, as we say, COPD may develop from years without any, may have developed for years without any noticeable symptoms, but then it's diagnosed over time. Some of the symptoms may include sputum production, which is the same thing as mucus, shortness of breath, which gradually gets worse. Then you can have shortness of breath while you're doing physical activities, and that physical activity doesn't always have to be strenuous exercise. It can just be walking.
That's exactly right.
Frequent coughing with or without sputum or mucus. Wheezing, you've heard people and you said they got noisy breathing. You can hear them.
Right.
It has that wheezing sound, that noisy breathing. They have a tightness in the chest. They complain of being tired. They have frequent infection, changing appetite because they're trying to breathe. So, you know,
Right.
you have a choice between trying to breathe and trying to eat, and then weight loss. And that can be a result of that as well.
Now I'm going to tell you what's interesting on this slide, Gloria, is that what a lot of people, I always tell people that you need to pay attention to the subtle changes in your
Right.
body. People talk about the subtle changes of aging. Like I used to say, well, I used to be able to squat easier. Well, you
Yep.
forget and you start compensating by bending at the waist. Well, it's the same thing with COPD. There are a lot of subtle changes that a lot of people don't pay attention to. For instance, shortness of breath, which gradually gets worse. A lot of people really don't pay that much attention to that, but that's definitely one of the signal symptoms. Shortness of breath during physical exercise. A lot of people, of course, attribute it to a lot of weight gain.
Right.
They don't attribute it to the fact that their lungs are compromised.
That's exactly
Wheezing
right.
or noisy breathing, they take that for granted. Frequent infections of the lungs. So a lot of those things that people take for granted, they need to pay particular attention to, and really ask their healthcare provider, who will send them to a pulmonologist. There's a
Right.
number of tests. There's a number of tests that individuals can take to find out, especially for emphysema. And I like to talk about emphysema. With emphysema, what happens is that here's an analogy that I like to use. If you take a balloon, when you blow a balloon, initially when you have a balloon, you blow it up and you squeeze it off and you let the air out. It comes out real quickly. But if you
Right.
stretch and stretch and stretch and stretch your balloon and you blow it up and you let the air out, you'll still see some residual air in that balloon. That's an example of emphysema. And when
Very
it talks
good.
about the air sacs become enlarged, the numerous air sacs become enlarged in your lungs, that's what happens.
Very good. Very
Next
good
slide,
demonstration.
please. Mhm.
Okay. COPD and other health problems, what we call comorbidities, things that occur together. Comorbid conditions seem to be more common in people with COPD than people with other medical problems. And these conditions can include high blood pressure, high cholesterol, people with heart disease, diabetes, osteoporosis, which is the fragile bones, depression, arthritis, sleep apnea, cancer, and other medical problems.
And in other words, besides having COPD, there are a lot of other of these particular diseases, high blood pressure, heart disease, diabetes, that go along with your COPD.
Correct. Correct.
Next slide, please.
Okay. We kind of talked about this a little bit, what causes COPD. Most cases of COPD is caused by inhaling pollutants. That includes tobacco smoking, things like cigarette, pipes, cigar, vaping, secondhand smoke. Secondhand smoke can a lot of times be more detrimental than just smoking itself.
That's
Uh,
exactly right.
Fumes and chemicals and dust found in many work environments that are contributing factors, people that work in factories and things like that. And genetics can play a part in it.
And I'm going to tell you something. I always tell people, when I was younger, I'm talking about in my late 20s, early 30s, I smoked those chest busters, Chesterfield cigarettes. And I inhaled them. I mean, it's funny the things that you can do that you just really don't put any medical significance on. And
Right.
I also smoked a pipe. I love smoking a pipe. And so I smoked on an average about a pack and a quarter of the cigarettes. And then in the evenings, I enjoy sitting back and smoking a pipe. That was I stopped smoking in my mid 30s, and so I just like to emphasize to individuals, and trust me when I tell you, I loved smoking,
Yeah.
especially after a meal. The first thing I
Yes.
wanted to do was fire up that Chesterfield. And so
Yes.
all these things over a duration of time are very harmful to your lungs. And you talked also about inhaling pollutants and fumes and chemicals. That's why it's very important when you're working with chemicals to have a mask. Like we're wearing a
Mask.
mask now because of this COVID, when you're doing things like that, you need to have a mask. Even if you are painting, it's very important for you to have a mask on your face.
That's right. That's right.
Next slide, please.
Okay. Smoking. Again, like we said, that's one of the leading causes. Smoking is the #1 cause of COPD in the United States. Smokers inhale more than 4,000 chemicals. Okay. COPD is most often occur in people 40 years of age and older who has a history of smoking. So again, that smoking is detrimental.
And Gloria, I want to make a comment. It says, these may be individuals who are current or former smokers. While not everybody who smokes gets COPD, most of the individuals who have COPD have smoked. However, only 1 in 5 smokers will get significant COPD. Researchers are trying to find out why some people get COPD and others do not. And a lot of that actually depends on your genes. And in another broadcast, I'm going to start speaking about and have someone come in about how it's important to know what your genetic makeup is.
Right.
That's extremely important. I'll go along with this here. But I always try to tell, and I know a lot of nurses know, just how damaging cigarette smoke is to the lungs. It's extremely damaging. And they would not put that little inscription on the side of a cigarette pack that cigarette smoking is a significant cause of lung cancer. They would not put that on indiscriminately. And so we're going to try to stress towards the end of this program on any of you that were smoking, exactly what you can do, because you can stop. And we're going to tell you how.
Right.
Next slide, please.
Okay. Some complications of smoking. Again, tobacco smoke contains more than 60 known cancer-causing chemicals.
The carcinogens.
Yes, yes. It causes lung cancer and other lung diseases like we're talking about now, COPD, chronic bronchitis, asthma, okay? Other cancers like mouth cancer, throat cancer, esophageal cancer. It can cause bladder, pancreas, just all kind of various cancer. It causes damage to your heart and your circulatory system, okay? It contributes to diabetes, eye problems, infertility, and impotence. If women are smoking during pregnancy, it can cause problems during pregnancy with the fetus. It contributes to making you more susceptible to cold, flu, pneumonia, any kind of respiratory problems, and can cause tooth and gum disease.
I just want to highlight just a couple of these things here. One of the things I said that I mentioned, Gloria, says, and I'm going to try to enlarge it. There we go. That smoking is the leading cause of lung cancer deaths. In addition, smoking causes lung diseases such as emphysema and chronic bronchitis. I want to go also down to the one that says heart and circulatory system problems. Smoking increases your risk of dying of heart and blood vessel, cardiovascular problems, including heart attacks and strokes. So a lot of individuals don't realize that not only lung cancer, but it's a leading cause or leads you into a lot of other health diseases that you can prevent just from smoking cessation.
That's right. That's
Next
right.
slide, please.
Okay. Now we're talking about what Pop just talked about, smoking cessation. Stopping smoking can slow down the progression of COPD. It will also make your treatment more helpful. Within just a few weeks of stopping smoking, your breathing, coughing, clogged sinuses, all of that can improve. So any little bit helps. Other benefits of stopping smoking includes it decreases your risk of the heart disease, lung disease, cancer, shortness of breath, gives you more energy, It improves your liver function, your digestion, healthier air in your home, in your car, because we know how all of that smell gets into everything, and puts money in your pocket. Less expensive.
Exactly.
So,
Because you want to know something? It's funny. I can remember, especially when I was in the military, I can remember a pack of cigarettes was a quarter.
mm,
And I used to stock. I told you I love to smoke, and I used to stock up. But you want to know something? The older you get, you realize that the earlier you focus in on doing the things that you need to do to stay healthy, and not get into any of the habits that you don't need to do, that's going to really
right.
be an impediment to your health. And the crux of the matter is that it's never too late to do it. I
To
think
start.
I mentioned to you and to Susan some of the things. My cholesterol was way too high. What I started to do, I just love those honey buns. I just love me some Snickers. You know, it's not. You don't have to deprive yourself. You just have whatever you do in moderation.
Exactly.
And the proof is in the pudding. I had some blood work done, and just from being disciplined enough to do all the things that I know to need to do. After all, I'm out here telling everybody about health. But a lot of the things that I love to do, eating that ice cream and a pound cake at 7 or 8 o'clock at night, that still has hey, Gloria, my mouth is water. I can't even get the word pound cake out. My mouth is watering right. Hey, look, and that pint and a half of ice cream, vanilla ice cream that I love.
They go together.
Just sit down there on that couch watching the TV, eating and going to sleep. So all those things that I know that I need to do. My blood work, this recent blood work that I had taken was the best that I've had since I was in the military. When I was in my late 30s, the best, because all the things that I need to do, I'm focusing on doing. And so what I'm trying to get across to our Facebook viewers is that it's never too late, even for
That's right.
smoking. If you
That's
are
right.
smoking, and we're going to cover some things, if you are smoking, it is now, and you love smoking, and smoking, by the way, is nicotine is a
Yes.
is very, very, very addictive.
Right.
Some
It
people
sure
say
is.
it's more. Some people say it's more addictive than heroin. And
Right.
so we're going to be. I want to leave the door open because a lot of people that I know that I've been after to stop smoking, I'm not going to give up. I'm going to let them know it's never, never, never too late.
That's
Next slide,
right.
Gloria.
That's right. Okay. To stop smoking, just make a plan. Set it, like Pop said, it's never, ever too late. Set a date to quit. Remove all the cigarettes from your home or your car. Um, just start wherever you can. Make a plan with your healthcare provider. There's things like Nicorette gum, a nicotine gum. There's nicotine patches. There's other medications that they can give you to help with the cravings. Put some exercise in your day. Just a simple brisk walk. Start to eat better. All these things that Pop just talked about that he did, and just in moderation, cutting out some things, and improved his health and his blood work. And reward yourself with the money that you save from spending the cigarettes. Ladies can buy them a nice lipstick. Men can buy them, a hat that they like, or a new shirt or something. But whatever it is that you want to reward yourself with, and get help and support from others, and from Smokers Quit Line, and from community and hospital sponsored programs. But put that support system in place. But
And I think that Susan had asked us to mention that November. I forget what's the title she
yep,
called.
got it right here.
Do you
November
have
the
it?
19th is American Cancer Society Great American Smokeout. So
Okay.
yes,
And
that's
so
the
that's
day.
November the 19th. That's this
Mhm.
month now. And
That's right.
and when I looked at the steps, and I will tell you all about viewing, I loved, with a capital LOVES, I loved to smoke. I loved to smoke. And and I like what it says here, to set a date. Now, I'm going to be honest with you. The one thing that triggered me, and I oftentimes think about some of the people that I love who are smoking, maybe they need a significant event. But I had a friend of mine, and I told you I quit when I was in my mid-30s. And this friend of mine got mouth and esophageal cancer. And
Right.
I went to visit him at the hospital, and this is when you could smoke in the hospitals. And when I went to visit him at the hospital, you know, and I saw the nurse suctioning him and whatever, he asked me, he says, they call me Newt. They said, Newt, he said, Newt, roll me down to the room. And I rolled him down to the room. It didn't occur in my mind. I thought he just wanted to get out of the hospital room where he was at.
Right.
When we went down to the room, he reached into his bathrobe, pulled out a cigarette, and started smoking. When the smoke started coming out, it was just horrible to see his condition like that. And it affected me so deeply that, well, guess what, Gloria? After I left him, the first thing, as soon as I got to my car, I fired up a Chesterfield.
Yeah. Yeah.
But you want to know something? It taught me that I needed to really quit. And I'm going to be honest with you, back in the day, they didn't have all these Nicorette gum and the patches.
Right.
And they didn't have what I'm getting ready to talk about right now. Now there are so many things besides the patches and the gum. I'm a big believer in group therapy, when you can get among a group of people who are going through the same struggles that you are with something, be it alcohol, be it smoking or whatever, that you can be mutually supportive of each other. Groups work. So I would encourage, I do know that there are a number of groups, smoking cessation groups here in Columbus that you can involve yourself in. And while I'm talking about groups, I want to talk a little bit more about Tree of Life Health Clinic. Reverend Dr. Lowell Client is the Chief Executive Officer. This organization does so much for individuals in the community who do not have any health care. New Horizons does so much for individuals who have behavior problems, depression, suicidal, schizophrenia, hallucinations, anything of that order. These two organizations are active in the community, helping the community. But you want to know something? These organizations need help as well. Volunteer hours, every organization that I know, to include these two, they need volunteers to come and help them take care of y'all in the community. Those are you who need the help in the community. And of course, I'm going to tell you, nothing happens without those dead presidents. I mean, that money makes things happen. No organization, no individual can help anyone without money. And so these two organizations, New Horizons Behavior Health and Tree of Life Healthcare, are two organizations we want to keep in the community, helping the community. And so I always want to take the time to say something like that, because it's important. And then a lot of the organizations that I'm going to bring on this program here that is out there, providing American Cancer Society is one of them. These organizations really need your help to help you. And so, okay, so Blair, I made my little pitch, and can we go to the next slide?
All right. Now we're going to talk about how does mental health play a part in this disease process. Depression and other mental illnesses is affected by COPD. Many studies show that an association between depression and smoking. Lots of people that's depressed and smoke. Even back into, you think about when they was institutionalizing a lot about mental health individuals and IDD individuals. So smoking was just a pastime, you know. They did lots of smoking. And people who have depression, schizophrenia, post-traumatic stress disorder, or other forms of mental illness are also more likely to be smokers. Again, going back to that health cycle, going back to COPD, emphysema, chronic bronchitis, making them more prevalent to lung and heart disease, other cancers, and all this. So it's just a vicious cycle. Also, people with addiction issues often trade one addiction for another. smoking, which, goes into the nicotine dependence. Just like Pop mentioned just a few minutes ago, people often say that it's harder to quit smoking than it is for them to break their heroin addiction or other
Right.
substance addictions. So they just trade off one addiction for another. COPD also has a tendency to cause people to, like I just said, to have depression, anxiety, and experience grief issues, which they will start to self-medicate with smoking, leading to sometimes even alcohol and other drug issues, which again just contributes back to the vicious cycle.
Right, that is exactly. And I can remember back when I did smoke, when I got under stress, the first thing I wanted to do was fire up a cigarette. Two things I did when I was under any stress or upset about something. I had to put something in my mouth to eat, or I smoked a cigarette. And so, a lot of these things that people go through, a lot of times when you just tell them in advance why they are doing it, it helps them, Gloria, to get off the addictive cycle, like eating. I told you I'd like to eat that. Well, when I was depressed, just give me another slice of that pound cake, another scoop of that vanilla ice cream. That type of thing. And when you let people know and realize that, and they recognize it, then they can take steps to change their behavior. And this is essentially all it is. Smoking became a habit to you.
Right.
Then because of the nicotine, it has become addictive. So just as you got on it, you can get off.
That's correct.
And so I know that we're going to be doing a program. Susan Gallagher is going to be doing a program on what everybody in this community is experiencing. People are smoking more. People are eating more. They don't know why. It's because all of us are changed now because of this pandemic.
Right.
We're feeling depressed and everything. And so the bottom line is that we need to learn more how to work to keep ourselves healthy. Next slide, please.
All right. And then lastly, we get here and we talk about treatment. There is no permanent treatment for COPD. Treatments are aimed at just reducing the symptoms, okay? Can't stress that enough. That's why prevention is worth an ounce of cure. There's no cure. We have to prevent. So they give medications, again, treating the symptoms. Things like bronchodilators, and those are medications that help relax the muscles in the airway and help them improve their breathing, to improve that shortness of breath. Oftentimes they'll use inhalers. You'll hear people talk about, especially like you hear albuterol inhalers, but any type of bronchodilators. And then they'll use glucocorticoids, and that'll decrease the inflammation in the airways. That'll help decrease that swelling, so you're able to, again, breathe better, cough up some of that mucus in those airways and get them cleared. So again, you can have some better exchange of oxygen in the blood flow and breathing better. And then as infections occur, they will prescribe antibiotics as needed to avoid or either cure any lung infections. Okay, so those are the three frontline forms of treatment. And then, lastly, is lung transplant, and that's when things have really progressed, and then they're having to have a lung transplant.
But I want to emphasize, it says there is no permanent cure for COPD. Two things to trigger. If you are smoking now and you do not have COPD, let this be a bell warning for you to stop. And there's treatment to help you stop smoking so you won't get COPD. Now, if you do have COPD, reality check. There is no permanent cure for what you have.
Right.
You have COPD. So now what's the game plan? The game plan then is for you to do whatever you need to do to stop the progression of it and to live a healthy life. And so to do that, there's all these treatments out here. So there's no cure, So if you have COPD now, the good news is, like, my blood work is better because I worked about. I'm not eating any of that ice cream and pound cake at night. Guess what? When I start watching Star Trek or some of the old movies that I love, do I say, I'm going to get me some of that pound cake and that pint and a half of vanilla ice cream? Sure.
Yes.
But I don't do that. If I want to snack on something, I get myself an apple, a pear, or something that's healthy for myself. I know to do that because my goal, God has given me 77 years. Guess what? Dear Lord, I believe in miracles. Look, dear Lord, I want to make it to 100. So the bottom, you hear me, Gloria? You hear what I said? That's right. So the bottom line is there's no cure, but you can stop the progression of it. And then at the same time, there are treatments that can help you live a high quality of life if you apply yourself. Right. And so the bottom line is the fact that there's two things that you can do. Get a healthy attitude about yourself, thinking about good things and working towards it. And right in the back, you saw my wife come in here. She's going up here to get something out of something healthy for me to eat and for her, some activity, I think. So next slide, please. That's it. All righty. Well, you want to know something? We've done really, really, really good. We've gone through our program. And at the end, we have New Horizons Behavioral Health, Tree of Life Healthcare. Those are the two organizations in the community that are providing all the care in the community that for you. And so just keep them in mind. Yes. We've gotten another program done, and you want to know something? We're almost at 30 minutes, so we're right on key for this program. And so, Gloria, I'm going to tell you, thank you so much for getting these slides together. I really appreciate that. That's a real blessing for the effort. I'm glad we have a lot of information to our Facebook friends and public. And let me just tell you something. Until next time, I always say, when I come on with Pop On's Health for Community Tips, until next time, please be good and kind to yourself. Yes. Because God loves you. Yes. Bye-bye. Bye-bye.